Welcome back. You're still watching Kaleidoscope on Channels Television. Let's tell you more about a leading supplier of medical diagnostic products and services in Nigeria. We're talking about ISN Products Nigeria Limited. Incorporated in November 1976, ISN Products Nigeria Limited is a leading supplier of medical diagnostic products and services in Nigeria. The company provides best-in-class products and services that meet or exceed expectations of customers, with a mission to give healthcare practitioners and patients peace of mind through innovative medical diagnostic solutions and a vision to become best-in-class healthcare-focused company in West Africa. The company equips hospitals and health centers with world-class scans, monitors, surgical equipment, theater equipment, ultrasound, patient monitoring systems, renowned diabetes management tools, and much more. ISN Medical's state-of-art medical diagnostic systems and tools enable clients' laboratories generate accurate test results, raising the bar of quality diagnosis and patient care in Nigeria and beyond. The organization currently enjoys partnerships with reputable diagnostic organizations around the world. Till date, ISN Products Nigeria Limited remains the authorized agent and distributor championing large-scale supply of reagent parameters for clinical chemistry and immunology. A household name in medical laboratory science, I asked the Executive Director, Felix Tofungu, how the business has survived almost half a century.
Well, I think we've been fortunate enough to have a very strong team over those years. We're very particular about the people we bring into the company, and we invest a lot in their training and in their development. We've been fortunate also that folks that join ISN tend to stay with the company for quite a while. And I think most of our customers will say that the ISN, the typical ISN staff is a little bit different from the rest of the folks that they come in contact with, from other suppliers. So we're very proud of the team that we've assembled and that we've kept over the years. I would also say that the quality of our partnerships is also part of that, of our advantage. We partner with companies that are in their own right household names in the medical field, folks like Roche, BD, Mindray. These are global, well-respected, reputable entities that we partner with, and we supply their products here in Nigeria. So that has also been a big part of our success story. And then finally, I would say that we try to do business the right way. I mean, it's really important to us that we run our business according to our core values, customer centricity, integrity, growth and development, performance. And by staying true to our core values, I think we have it has really helped us to register some success over that period of time. And of course, there's also the good fortune, just that, good luck over the years.
A lot of times we talk about doctors, we recognize nurses in the medical profession, but medical laboratory scientists, we don't hear a lot about them, if you ask me. But you have an initiative, a platform that gives them an opportunity to be recognized and awarded. What's the driving force behind this initiative?
Well, exactly what you said. I mean, we've recognized over the course of our existence as a business that medical lab scientists are sort of the hidden practitioners within the healthcare landscape, and the work that they do is so critical to the overall quality of health outcomes. And we thought it made a lot of sense, particularly with this pandemic, where without lab scientists, there is no measure for the spread of COVID or the numbers associated with the pandemic. The work that they do is so critical to getting all of that information out. So we thought it made a lot of sense to really, one, contribute to improving the stature of the profession by highlighting the contributions that they make to the overall healthcare, of the country and of, frankly, the world. and two, also celebrate quality in medical laboratory practice, along with highlighting their contributions to healthcare.
And talking about contributions to healthcare, I mean, they say doing good is good business. What are those initiatives, other ones that you have done to contribute your own quota?
Yeah, we're particular about how we contribute and support the various stakeholder groups that we engage. So we started an initiative some years ago where we contribute, or where we devote a certain percentage of our profits every year to two areas. One is CSR-related activities, and the other is research and development. On the CSR side, we've partnered with a number of associations over the years. The Diabetes Association of Nigeria is perhaps chief among those. The Association of Medical Lab Sciences of Nigeria is another. And we contribute to several efforts and initiatives that they run throughout the year. I think that really came to bear in last year during the height of the COVID pandemic. And then on the research and development side, not only do we support individual researchers in their research efforts, but we've also partnered with the International Research Center of Excellence, which is based in Abuja, to sponsor and support research studies that they run. And we currently have one, it's a multi-year study that we are partnering with them on, and we're quite proud of that association.
Right here in Nigeria, we know the problem of misdiagnosis is still a very huge challenge right here. A lot of people have lost their lives because of this. I know someone who has also personally, but what do you think is the real problem here?
Yeah, it's a good question. I think there are several aspects to the problem. So it starts with, I don't think there are enough lab tests being done, right? So the typical interaction, or the way an interaction with a doctor is supposed to happen, is, a patient comes to a doctor, complains about, whatever it is that's ailing him or her. The doctor takes the history, does some physical examination, comes up with a hypothesis as to what might be wrong with the patient. Now, the last stage is that, the doctor is supposed to confirm that hypothesis with lab tests. But unfortunately, many times it ends there, right? After the physical examination and taking the history, the doctor then pronounces, oh, you have malaria or whatever it is. And there's so many diseases that present similar symptoms as malaria or whatever else. And so it's essential that the hypothesis as to what might be wrong with the patient is confirmed by lab results, by lab tests. And I think we need to really make that a sacrosanct part of the entire interaction between a patient and a doctor in all cases. Now, secondly, let's assume then that the doctor actually orders some tests to be run. Then it comes down to, well, what's the accuracy of that entire lab process, right? From the drawing of the blood, if it's a blood specimen, or the collection of the specimen, whatever it is, to the handling of the specimen, to the storage of the specimen, to the analysis portion of it, what instruments are being used, what's the quality of the instruments that is being used, how often and how well are those instruments maintained, are they calibrated? If we are not checking and confirming that that is happening the way it should, then unfortunately we'll have cases of misdiagnosis.
Unlike so many people who travel overseas for greener pasture in their own terms and just stay there, especially those in the medical profession, you had most part of your education abroad, but you came back here to manage this business. What attracted you to decide to do this?
I have an opportunity to run a business that has such a direct impact on the lives and welfare of millions of people, and there aren't many places in the world where one gets such an opportunity. Well, I mean, there are definitely we still have some ways to go when it comes to healthcare in Nigeria, for sure. But I choose to look at that as an opportunity to contribute somehow to furthering our development and supporting our development in healthcare practice. And that excites me. That excites me.
Investment in research in the laboratory field in Nigeria is still relatively low, if you ask anyone. What do you think is responsible for this, and what do you think can be done differently?
Well, investment in healthcare in Nigeria in general is low, right? I think in 2001 was when the African Union, members of the African Union got together in Abuja and came up with the Abuja Accords, which sort of called for member states to devote 15% of their budget each year to healthcare. And Nigeria was one of the signatories to the Abuja Accords, of course being the host of the convention. And I don't think since then there has been a year where we have contributed that much of our national budget to healthcare and healthcare related initiatives. I think we hover around 2 to 3% generally. At ISN, what we're doing is, in addition to contributing to several research efforts by both individual researchers and research bodies, we are in the middle of constructing a research lab ourselves, actually, and we hope to launch that this year.
Okay, and talking about things that you'll be doing this year, what other future plans do you have in terms of growing your business, of course, especially? I mean, because without making progress in your business, you can't help other people in the society. So tell us those plans you have in the next year, the next 2 years, 10 years, and 40 years.
How much time do we have? We have a lot of plans. Yeah, well, we have a lot of plans. I mean, this year, and always really, the focus is always how do we get better at serving our customers. We're looking to supply products outside of our laboratory, our core laboratory products, products that hospitals would need, products that patients could use at home. So a big part of our plans is to expand our product portfolio. We also are looking to increase our distribution footprint across Nigeria and now Ghana, where we also play. We currently have 10 offices across Nigeria. We're looking to increase that to between 13 and 15 this year. And we never stop investing in our people, in our team. And so we have a number of initiatives lined up this year. And then additionally, we plan on launching what we call the ISN Academy this year. The goal is to foster a community of the best laboratory scientists in the world.
This is also an opportunity to commend all health workers around the world on the front line. We all appreciate your efforts. This is where we end Kaleidoscope for today. Don't forget, catch up with past editions on youtube.com/channelsweb. I'll see you again next time. I'm Anne Nwawadu. Thanks for watching.